project intake, that's pretty important. And you talked about it a little bit earlier. How do you prioritize the stuff? Do you have, is there a governance process, or how are you prioritizing the work? As you said, it's the work finds you. It's people knocking on your door. How do you get it into the pipeline?
So I have my sort of dream fantasy scenario where people are like kickboxing and whoever's left standing like gets their project done first, right? But, but apparently like there are better ways to do it than that. Getting prioritization is an institutional function. Like knowing what to work on is something that every institution really needs to spend time developing a process and governance. And you want to make sure that when projects go into, let's call it the project bucket, that the low cost, high benefit projects identify themselves, and also the things that are clear safety issues or risks to the organization also need to identify themselves. And the low benefit, high cost projects kind of bolt down in the list. So how you actually measure that? What are the questions you would ask to know, is this a low cost, high benefit, or is this a high cost, low benefit? Though getting those questions right is really requires a lot of sort of strategic planning and thinking, and you want to develop algorithms like measurable like ways of constantly looking at those projects. And there are some very impressive tools that I've seen and that I've personally helped implement, where you're looking at the risk to the organization and the risk to patients that brings things more to light, and those topics get discussed. Personally, in my role, I discuss every project, whenever people have ideas, they come to me and I listen to it, and I try to give my own personal analysis of it. But it's very helpful to have a formal methodology for it, because otherwise it becomes one person's opinion versus the other, and that can lead to arguments.